Hello friends, this is Dr. Cüneyt Sevinç from Urology Istanbul. We are a urology clinic in Istanbul which mainly deals with urologic cancer surgeries, urologic stone surgeries and infertility surgeries. Today I want to share with you a good news from a very important journal from Germany, from Europe, which is one of the oldest journals of the Europe about andrology subject. This is the name of the journal is Andrologia. They accepted our study concerning the effects of and the advantages of using microvascular Doppler device in varicocelectomy operations. This is a special device with a Doppler ultrasound probe at its tip, which has 1.5 millimeter thickness and is used to find out arteries in spermatic cord. This is a critical part of varicocele surgery. Before this, we were using microscope only to magnify the vascular structures in order to dissect the varicose veins which causes harm to testicles and get rid of them while we try to preserve testicular artery, which is responsible from getting blood and nutrition and oxygen to testicles. Very commonly, this was a challenging situation. When we dissect the testicular vessels out of the body, the surrounding tissues are commonly they make some effect in this dissection. They usually get into a shock state and the arteries stop pulsating during the dissection. If there is no pulsation, we can't understand which vessel is the artery and which ones are the veins. But with microvascular Doppler, we can easily and quickly hear the sound of pulsation, and we identify artery and dissect it out easily. Then we double check every vein before tying them if there is any pulsation in it. Because sometimes there are little tiny arteries which don't have strong enough pulses to be seen with our operation microscope. And this causes problem. You can tie these arteries assuming that they are veins because you see no pulsation in them. But this with our microvascular Doppler device, we can easily identify the arteries from the veins. So in our accepted study, we compared 113 patients which operated with the aid of our new microvascular Doppler device, and compared them with 115 patients who were operated with microscope alone. The results were in the favor of using the microvascular Doppler. First of all, the average number of veins we treated with microvascular Doppler was over 6 in our study group, whereas they were 4 to 5 in standard group. The situation was more prominent with recurrent varicocele patients. This operation is more tricky than the normal one because the tissues are more fibrotic and stuck because of the previous procedures. As it is more difficult to dissect the vascular structures and it is more common to leave behind some of the suspicious tiny vessels because of the uncertainty of their nature as being an artery or vein, it's more important in recurrent varicoceles. So in our study for the patients with recurrent varicocele, in microvascular Doppler group, we treated, find out and tied and get rid of average 4 vessels in microvascular Doppler group. But in normal group, it was around 2 to 3 veins in average. When we compare the sperm parameters after the operation, the success rate was significantly better in microvascular Doppler group. Maybe the most important of all is the surgeon-reported easiness of the operation. It was very satisfactory for microvascular Doppler group. So as a conclusion, we are proud to prove the truth that we know, and most of our patients are aware and what they come us for. The microvascular Doppler is good in giving advantage to varicocele operations. And we are happy to publish our findings in a scientific platform and hope that more doctors will be aware of this new device and they will experience the benefits of it in a short time. We wish happy and healthy children to all couples with best of our wishes.